Hi, I'm Dr. Tobin, one of the ear, nose, and throat doctors with Ohio ENT and Allergy, and we're going to talk today a little bit about ear tubes, which is obviously a very common thing that gets done in an ENT practice, and we see lots of young families with babies who have ear infections, and we get a lot of questions, so I thought I would talk about this briefly. Ear infections are common in babies. 80% of babies will get ear infections, mainly because their eustachian tubes are still developing when they're born, and they're angled a little bit differently. And the eustachian tube is what equalizes the pressure behind the eardrum. And it's the eardrum and the ear bones that amplify the noise that we hear. And we have an airspace in there, and our body in general doesn't like air spaces, so we have a eustachian tube that equalizes pressure. Babies' eustachian tubes are developing, their immune system is developing, they're getting more colds, and all of those things lead to fluid that can collect behind the eardrum, and fluid can lead to ear infections. And any parent will tell you it's not fun. Ear infections cause fever and pain and irritability, and it can cause hearing to drop and can cause speech delay. And for all those reasons, we want to treat ear infections. And the first way to treat them is with antibiotics. And antibiotics are wonder drugs and can get rid of infections, but they can cause problems as well. They can cause GI problems and allergic reactions, and for a lot of reasons, we try to avoid antibiotics when we can. And so we've got this balancing act. We've got the child who doesn't feel well and the infection, and we want to treat it, but we don't want to do multiple rounds of antibiotics. And so the children that are getting repeated infections are the ones that come to the ENT doctor, and what we'll talk about is an ear tube.